Hello, students. All right. Today's topic is trauma-informed social work practice. This is a very important aspect of social work practice that we really need to learn about and avail ourselves to as we start to look at a lot of the events that are happening in the world and a lot of the traumatic things that happen in people's lives that cause them to, revert to sometimes maladaptive behavior. So hang on, bear with me, and let's get started. So let's talk about, first of all, what trauma actually is. And as you can see here from the definition, we've got trauma can be either an isolated event or an ongoing experience that can be physically and emotionally harmful, life-threatening, or causes individuals to feel distress, fear, hopelessness, and helplessness. So when you think about that particular piece, I would dare to say that all of us who reside on the planet have or will at some point in time experience trauma. And it's about how that trauma impacts us that we need to be concerned about in social work practice. We also see here that trauma can affect different groups in different ways. So, two people can be exposed to the same set of circumstances and have two different trauma responses as it relates to how they interpret that process. That can be either long term as well as intermediate effects in terms of trauma. And so, we just need to be aware of those things that happen in people's lives or in the lives of our clients. And then trauma also affects different individuals and groups in different ways. And so, an example of these different forms of trauma here, we've got the individual trauma, and we've got the examples here. Single event that occurs to one person. It could be an assault. It could be being severely injured in a car wreck, things of that particular nature. I know people who driving in Minnesota have had significant accidents on the ice and they weren't hurt, but they refuse to drive when there is ice or snow on the ground. So again, this that traumatizing effect that prevents them from involving themselves in that behavior because of what has transpired. Community trauma, and that's trauma that affects an entire community. So when there's gang-related violence, there's a drive-by shooting, when a child is shot on a playground, or when there's a school shooting, that's a community trauma. So there is a traumatic event that causes people in the community to feel hopelessness and to be in despair. We also have group trauma. So there are things that traumatic experiences that are shared by specific groups. And so when we think about members of our military, when we think about our first responders, when we think about even members of our law enforcement or folks who've experienced war, there's a traumatic impact that goes along with repetitively being involved in those kind of life-threatening situations that they find themselves in. And then mass trauma. So when we've got uh, large disasters, earthquakes, hurricanes, terrorist attacks. So September 11, 2001 is something that grained in people's memories forever. So those are the kinds of traumas that folks experience, and it impacts them in different ways as well as it impacts their behavior and functioning. And there are also different types of trauma. So there's this traumatic stress response that people have. So find themselves in situations where they're doing the fight, flight, or freeze response. And this can have this intense physical, emotional response that can have long-lasting impacts. If a person is um, held up or carjacked, let's say, for example, someone walks to your car and puts a gun in your face. That's a traumatic experience, and you may not know how to respond in that particular moment based on that traumatic stress. Then there are complex stress. It's exposure to multiple and simultaneous prolonged events. The feelings and behaviors associated with complex trauma can also produce a domino effect, facilitating subsequent and repeated trauma. So when there are killings that happen in our neighborhoods, if there's a continual pattern of abusive behavior by law enforcement that results in the death of people, then that's a complex trauma. So every time there's an incident, it re-traumatizes folks as well in terms of that whole complex trauma. And you have these prolonged tragic events that just kind of are waiting till the next event happens. And then the whole notion of re-traumatization, again, also includes re-experiencing those traumatic stress symptoms in new or similar situations to the prior trauma. So again, being aware of these are the things that our clients and groups and communities will bring to us in terms of trauma that need to be dealt with. And then finally, these last two pieces of different types of trauma, and you've got secondary or vicarious trauma. So these particular types of trauma are often seen in those of us who are in the helping profession. So those of you, or us social workers, psychologists, therapists, um, trauma counselors, mental health counselors, are people who are actually having secondary exposure to trauma, which actually impacts them. So, helping and empathizing with others who experience these trauma events, we become trauma survivors in and of ourselves. So, this is one of the reasons why self-care, which we'll talk about in a couple of weeks, is such an important aspect of social work practice, to make sure that we're taking care of ourselves so that we don't burn out and we don't become overwhelmed by the vicarious trauma that we experience from our clients. And then finally, we have historical trauma. This is also known as generational trauma, and it's traumatic events that are experienced by a specific cultural, racial, or ethnic group. And there are some examples here in terms of the enslavement of Africans. When we think about the forced immigration and colonization of Native Americans, when we look at the genocide of Jewish populations to the Holocaust, these are traumas that are etched in history, but they also have psychological and physical impacts on populations, resulting in individuals being hesitant to either enter into systems of care because they have historically oppressed those populations. So a lot of times we'll see in some service areas there's an underrepresentation of communities of color. And the reason why is that based on the history in terms of interfacing with the system, it has not always ended up in a good situation for those individuals. So just you as a social worker need to be aware of these various different types of trauma and how they manifest themselves when we're working with clients. We also have trauma that impacts different populations in different ways. So when we think about racial trauma, if you look at the news long enough, if you look at YouTube videos for any length of time, you can find multiple examples of racial trauma where people are discriminated against just based on their race. When I think about the Asian hate or this whole rash since the pandemic has started, where members of the Asian community are under attack because people falsely believe that they're the reason why we have the coronavirus. And then it's not helped when it's perpetuated by members of our leadership in government that continue to do these things. And we continue to see people victimized just simply because of who it is they are. And there are other examples here in terms of police harassment, workplace discrimination, community violence, and then mass incarceration. When we think about who's in jail and who's not, as well as people who are experiencing difficulties immigrating. So when you think about the people who are at our bordering countries that are trying to escape a really bad situation that they might be in, they're treated different, and it's based along lines of race and ethnicity. Also, recognizing that individuals with disability, especially those with physical, sensory, or behavioral health or intellectual disabilities, are at higher risk to experience trauma, and they're more likely than the general population to be victimized, violent victimization through sexual assault, or to be abused as children. So again, when we look at who our clients are and who's coming to us, these are the things that we need to take into consideration as we start to look at how we connect with them, how we assess in a way that really takes into account the trauma that they have experienced. So when we really think about trauma-informed social work, there are really two questions. Oftentimes, social workers will see or experience behavior from their clients that just does not connect to anything. It seems to be bizarre or erratic or coming kind of out of left field. And sometimes, if we're not careful, we can re-victimize our clients by, labeling them inappropriately based on the behavior that we see and that we're experiencing from them. When in reality, the questions that we probably should be asking are these two here. What happened to you? Because typically, if you got a traumatic event that has happened, something has happened to you that may be causing you to respond the way that you are or act the way that you do to keep yourself safe or to prevent the recurrence of the original trauma. or what did you not receive? So oftentimes we see maladaptive behavior because people miss certain things. People were victims of neglect. People didn't have things provided for them in a timely manner when they were children or when they grew up to be adults, or people withheld emotion or food or things of that particular nature. So when you've got those types of neglectful pieces where people didn't get all of the things that they need to develop adequately, then we can start to see some of that traumatizing behavior. This also helps us when we're doing our assessment to really get a sense of how our clients kind of came to be where they are. So, what do we do about all this? We look at trauma informed social work practice. So, this is the strength based approach that guides us as social workers to work with individuals and communities who've experienced histories of trauma. It's a relational approach to social work that promotes a feeling of safety, collaboration, empowerment, creates opportunities for individuals and communities to rebuild, heal, and restore a sense of control and well being. So it's really looking at how we work with families or communities through this particular lens that empowers them to be able to move beyond some of those traumatic things that have taken place. So when we're thinking about applying this particular form of social work, these are the areas that we need to really kind of concentrate and focus on. So when we think about our assessment, it just should become a routine apartment, a routine practice in terms of how we do our assessments, by looking at what kinds of experiences that we need to be treating as traumatic that clients have actually experienced. And sometimes clients may not even realize that they've experienced. So sometimes it's our job to, once we hear the stories and think about the impact that we're seeing, it's about informing them that they have probably a lot of their behavior is a result of the traumatic stuff that they've experienced at some point in time in their lives. It's a collaborative posture that supports client autonomy and choice whenever possible. So really letting your client kind of drive the things that need to be addressed and what needs to be worked on. You have to be trustworthy and transparent in your relationship with the client. Otherwise, it just doesn't work. If people aren't able to trust you in terms of the working relationship, they're probably not going to share the things that make them the most vulnerable. You need to create a sense of comfort and security and safety in your agency where you're working with people. So making sure that people in the agency are aware of this trauma-informed practice piece as well. Many agencies these days actually are. And then they build their services to accommodate that. And then be aware of how these own traumatic experiences in unexpected ways can trigger your unresolved trauma if you have that. So things like that we need to keep in mind. And then finally, uh, acknowledging the cultural, historical, and gender issues. So recognizing that the importance of an individual's traumatic experience and how they interpret, how they heal from that, also being able to provide the services that are culturally appropriate, that acknowledge history, and that gender responsive providers to actually look at also leveling traditional cultural connections. So there are different practices in different ethnicities and different nationalities that we need to pay attention to. If they think these things are important in terms of how we need to proceed, then we need to look at how we involve that and empower them to do that, to address the historical trauma. And remember, we're also responsive to racial, ethnic, and cultural needs of the individuals that we serve. Um, so that brings to a close my very short lecture in on trauma informed social work. So now we understand what trauma is, we understand how it might manifest itself, and now we understand also what we should be doing as social workers as we intervene and use this particular practice model to work with our families to ensure that we give them the best possible chance at recovering and getting back to behaviors that are in their best interest. So thank you for your time.